Here I'm sharing a couple of short extracts from a conversation I had with Mr Orwa Falah, consultant vascular surgeon in Edinburgh. These are just short extracts, first a quote and then him talking a little bit about more junior colleagues asking for support and how normal and expected that is. I hope to return to him for a longer interview. So please, if you appreciate this kind of conversation, if there's something here that's helpful to you, then please do get in touch and let me know.
So the most dangerous thing for any surgeons to feel that they can perform at the level of a god. And when they feel that feeling, they will be completely closed to any opinion. They won't see any problems around them. They won't take in consideration the patient's safety when they have a problem because they think that they can perform to a level that there is no potential problem can happen.
And here's the second extract.
So the young surgeon, they don't have the level of experience like the one who's been in practice. They've done it, they know it doesn't work. And sometimes the young one do it, or they come for you advice. What do you think? You knock on the door and let's have a look on the scan. I said, I would suggest this. They take it. And sometimes they need you in theater, you go and help them. Sometimes they have a complication, you discuss an M&M, and you know how they perform. This complication can happen. You give them support because it's very important to give your colleague a support when they have a problem because they feel down about it, providing they have insight. But not everybody have insight. Somebody have a complication, just yeah, these things happen. No, it is not. It needs to be done maybe that way, I would suggest. Uh, they will fear doing another case when they have a complication. So you need to say, well, I'm available if you need me around. You know, do it when the day I'm around. I will be around. I don't need to come to theater. If you feel that my contribution will be useful for you, just, you know, phone, I will come and stop in and give you support. You need to do that because
Yeah.
at the end, we're talking about patients on the table. They might need you there extra, providing the one who's performing surgery have also insight to ask for help we care for.
Yeah, yeah. And I think just hearing you say that how normal it is to feel insecure when you've experienced a complication, to need
It
that
is,
support.
especially the younger one. They do.
Yeah,
They
yeah,
do. Maybe they don't show it, but they do. You find maybe they're fearing doing pushing not to do the next one or something. No, it's you do it. The next one, you go and support them. Maybe the other one, then they go and sail by themselves. It's just like a bicycle. You just ride it, and
yeah,
you fail the first time, you fail the second time. In medicine is more important because we're not dealing with a young child. You know, when you have kids, they fail, you just let them look at them. They need to stand by themselves to learn. It's okay. But the mistake on the patient is different.
yeah. There's a lot at stake.
It's a you can't compare a consultant surgeon to a pilot. That's your example you can use.
Hmm.
You have a number of flights to be a captain. It used to be for a consultant surgeon hours, 32,000 hours of training to become a consultant. Now they cut them to 15,000, I think. I'm not sure about the exact number.
Yeah, but
So yeah, to be a captain, you're diving, you know, you're flying an airplane with 500 people behind you. Their life depends on what you do.
well, it's interesting that you say when the hours needed to become a consultant have been cut so dramatically that it's not surprising that people are therefore less experienced, and
Yes. Yeah,
therefore
yeah,
there will be these issues. And I
yeah.
think again, you said people might feel insecure, but they don't want to. Of course, they don't want to say so. So again, that's one of the reasons why it's helpful to have this conversation kind of in open forum, because if you feel like you're the only one feeling like that, that's very isolating. But I would think probably every inexperienced junior surgeon is feeling that, or new consultant has those feelings sometimes.
Of course.
As I said, if you would like to hear more from Mr. Falah on this topic or others, please let me know, and he has indicated that he's willing to be interviewed further.